When Angela Flaxon was first diagnosed with kidney failure 6 years ago, she felt her future, her plans, and of course her life shattering right before her. At first, the 52-year-old Angela could not accept the turn of events in her life. The state of her life now requires that she goes to the hospital to be placed on a dialysis machine for 4 hours on each of the days that she travels to Kamuzu Central Hospital in Lilongwe. She sometimes faces challenges, especially when the machines are down. Then her only option is to travel to Blantyre, over 300 miles away. But traveling from her house at Kawale to Kamuzu Central Hospital twice a week is costly enough because Flaxon is unemployed.
Since I was diagnosed with a kidney failure, I'm facing quite a lot of challenges. Some of the challenges are sources of getting the medication. It's very hard because most of the times there's no medication at the hospital, so they tell you go and buy. So for me to go and buy, because I'm jobless, I can't work anymore now. Since I was diagnosed with a kidney failure, I can't find a proper job because no one can employ you to go to work thrice a week and thrice at the hospital. They will ask you, we can't hire you because you have to go to work for 5 days a week. But for 2 days a week going to hospital and then you wait 3 days to go to work, it doesn't work. So for me to get medication, it's very, very hard because I'm jobless. And then in other ways, coming to hospital thrice a week, for me to get transport monies, it's very, very hard. You can try a business, as you know.
Like all other people living with non-communicable diseases, things could be improving for Angela. She's now part of a group of people who frequently meet to share their experiences as people living with NCDs and discuss how best to tackle them. Through community conversations with fellow people living with NCDs, Angela has accepted her condition and is moving on with her life. She's now able to do household chores and other activities which she was not able to do in the past.
Talimbikitsana wina ndinzake amene analindi mtima ofoka kuti nende kudwala but ndenda iyi I don't know kuti ikathera kuti watengapo china chake chifukwa ona wina aliyesa maperekera comment yake kuti ntenda ziliko kunja kuno zosiyana koma people who are living with those diseases ndipo ndimuchati makana kuti asamatiitane ndi maina oti oyu ndodwala impsho wa impsho uja. No, they must call me Angela because intenda ija nangondipeza, but I'm still that Angela.
At area 49 in Lilongwe lives Isaac Chinkola, a person living with hemophilia, a rare condition that affects the blood's ability to clot. Isaac's condition was discovered in 1986 while 2 years old. Life has never been the same. The challenges are many, but Isaac cites shortage of factor 8, a drug used to control bleeding.
Here in Malawi, government doesn't provide medics to support for us as people with hemophilia. We're only depending on donors, so that's a very big problem. Even my tests even the test of hemophilia, we always rely on donors. The government doesn't provide to us, which is a very big challenge for us.
Jones Rogers Kalua of Chilinde 2 in Lilongwe is also living with an NCD. As Angela and Isaac, Kalua also cites shortage of personnel and medicine in the country's health facilities as one of the biggest challenges people living with NCDs are facing to access support.
Since 2003, takatutandizika kwambiri kwandiri pa clinic ya sugar. Imene manurses ma doctors amatithandiza kwambiri. Agwira ntchito yotamandika. Indi pali ma challenges chifukwa choti mankhwala amasowa ena timakagula toka. Pali ma challenges ngati maso, ma glass, aja owerengera ndiyo distance. komabe ndithu akuyesesa kutithandiza.
The NCD Alliance in Malawi, together with Our Views, Our Voices, has been conducting community conversations with people living with NCDs to better understand their needs and challenges and to find out from themselves how these challenges may be addressed. NCD Alliance Vice Chairperson Modi Mwakasungula says the conversations will inform the national advocacy agenda and the global charter on NCDs.
So this is just a fraction of people living with NCDs who are actually able to interview and talk to, but the problem is quite big. As already said in the meeting, that most people don't even know that they have NCDs, but it's quite a big problem. If you look at it, the NCDs are causing quite a lot of death around, and especially in the time of the pandemic. So the problem is quite a big problem. Mostly what we're trying to do is that there's a saying, they say nothing for us without us. We want people living with NCDs to be involved in most of the decisions which are made, which are concerning them. So it's something which has to be on the ground where they should be meaningfully involved, they should contribute. And on the other hand, we're trying to bring awareness to the public on different risk factors of what causes NCDs. The public should be aware, because if they're not aware, they are not able to prevent those kind of diseases. So that's what we want to bring out there.
George Jobe, a health rights activist, warns that many Malawians are living with NCDs without knowing it because of lack of health-seeking behavior. Jobe calls for more initiatives aimed at sensitizing Malawians on the dangers of NCDs and the importance of early health-seeking behavior among the population.
This challenge, the non-communicable diseases, is common amongst us and is getting more common. We have seen more sudden deaths happening than before. And when you go to the clinics, like diabetes clinics, and you even talk about other NCDs, asthma, cancers, they are coming more common and common. But unfortunately, most people do not know about NCDs.
The NCD Alliance is leaving no stone unturned in efforts to ensure that voices of people living with NCDs are heard. Through engagements with the people living with the NCDs themselves, government officials, health workers and activists, challenges that people living with NCDs face while accessing services in health facilities are heard and addressed. Hastings Chutuzu Chiumya is Assistant Director of Clinical Services in the Ministry of Health. At one of the engagement meetings in Lilongwe, Malawi's capital city, Chiumya reiterated the government of Malawi's commitment to addressing challenges that people living with NCDs are facing.
As the government, through Ministry of Health, we have actually taken the issue of NCDs very, very seriously. Suffice to mention of the establishment of the non-communicable disease and mental health unit by the government through Ministry of Health in the year 2011. Further to that, the existence of important policies such as the Health Strategic Plan 2017-2022 and also the NCD Strategy 2017-2022. These are actually documents like the Bibles, which outlines all issues related in the fight against non-communicable disease.
For a country where 28% of all deaths are attributed to non-communicable diseases, concerted efforts to fight the conditions are a must. But Malawi's health sector delivery system remains overstretched, with the country having 2 dialysis machines, one in each of the country's biggest referral hospitals, Queen Elizabeth Central Hospital in Blantyre and Kamuzu Central Hospital in Lilongwe.